Hello, good morning. A lot of time, physicians like us are being thrown into leadership positions. And not all of time we are comfortable doing so. And not all of the time we are qualified or even trained to be a leaders.
We spend endless hours, many sleepless nights, training to be healthcare professionals, healthcare workers, and we find ourselves ill-prepared for the leadership roles that we find ourselves in. We find ourselves ill-equipped to do the administrative and managerial tasks that are thrusted upon us.
My name is Amirul Amza. I am a family medicine specialist from Malaysia.
My name is Ryan Davids. I'm from Cape Town, South Africa. I'm an anaesthetist and intensivist.
And we are from the Young Physician Leaders Program. And today we are going to bring to you guys.
Everyone can lead. Let's do it effectively.
So, just to give you a brief introduction about what is YPL or Young Physician Leaders, it is actually a program that is being organized together by InterAcademy Partnership, together with the M8 Alliance, to bring young leaders, young physicians who have leadership potential like us, a global opportunity to have some global networking and also some training in terms of leadership so that we can bring these training skills in our country. So without further ado, probably Ryan would like to tell us what are we going to talk about today.
Not to delay too much, I just want to let you know that we plan to, in this session, to challenge you into discussing what is leadership, what does effective leadership look like, and how can we do this effectively.
Right. So perhaps we will pass it over to our colleagues, Cristina Genovesi, in order to start the whole session.
Hello to everyone. My name is Cristina Genovese. I'm a young physician leader. I'm a public health specialist in Italy. And now I introduce the first session. Leadership is everyone's responsibility. And so all panels are invited to join us.
And please come on the stage, our first 4 panelists.
Good morning, everyone. I take this opportunity to thank, on behalf of this panel and all my colleagues, for our Scientific Society and an InterAcademy Partnership and the Young Physician Leader Program especially, for the opportunity to participate in this World Health Summit. The health of everyone needs to have a quality and effective health systems. Health challenges change over time. My name is Arnaldo Marin. I'm the PhD oncologist from Chile, and together with my colleagues.
Elena Temido, good morning. I'm an internal medicine doctor and a PhD student from Portugal.
Lorenzo Blandi, I'm a public health specialist from Italy.
Yeah, good morning. My name is Hippolyte Darimo. I'm a public health consultant from Tanzania.
So in this panel, we talked about for the leadership is everyone's responsibility. We hope that at the end of this panel, we can understand that promoting and developing young physician leaders is a responsibility of everyone. So Elena, tell us what is an effective healthcare system?
So good morning. We discussed this a lot in the last few days, and actually it was a definition that we struggled to get with. So you give it to me to present it. Thank you so much for that. Thank you. But now seriously, an effective health system is one that not only produces healthcare without waste, so that is an efficient health system, is one that produces and delivers healthcare with a meaningful impact in the health of a population. That is the main goal and the expected result in this type of system. And as we've discussed this during the last few days, that is different and can have different perspectives all throughout the globe, and it's different for each and every one of us. That's what we need you to remember, not only the definition, but there are different perspectives for it, okay?
All right. So why do you think it's important for everyone to have an efficient healthcare system?
So we all know from our personal experiences that our health systems are being put through an immense amount of pressure today. There are troubles with the increase in costs, the lack of sustainability of health systems, with the increasing age of the actual workforce, also with the COVID pandemic, these geopolitical crises. All of this is putting pressure in our health systems. And actually to overcome this, and they will help us overcome these issues. To overcome this, we need to change not only our practices, but also our policies. We need to build healthier health systems that can improve the quality of life for our populations and develop our communities. I think the WHO says it very well, and I'm going to quote on this because I want you to listen to the full sentence. Everyone knows the first part, but the second part I think is very important. The WHO says, "Health of all people is fundamental to the attainment of peace and security," okay, we all know this, "and is dependent upon the fullest cooperation of individuals and state." So individuals, they are meaning us. Okay, each and every one of us can improve healthcare delivery to all, in a good quality to all. So we need and we welcome this increase in the interests of health and health policy and health governance, because actually it's a bottom-up approach to health coverage, to universally health coverage, for example. That is why everyone's opinion matters. We know what matters to us, okay? And actually that's why we, as young physicians, now I'm speaking about us, but everyone can be a part of it, not even, you don't have to be a physician to be a part of healthcare, okay? We as young physicians have this immense and great opportunity not only to learn from our predecessors, but also to carry this and to have a meaningful impact on the delivery of healthcare that matters. That's what I think is really important to grab from this.
Thank you, Elena. So we discussed a little now about the healthcare system. Let's go now for what is the title. Young, we are emphasized young and leadership is everyone's responsibility. Why? Because they will be the lead, the change of the future. The change in the healthcare system will affect everyone. So efficient healthcare system require responsible leadership. We need to invest in that, in the healthcare system and the future leader that we want to lead the change that society needs. We must consider different aspects, ethics, equity, responsibility. So in some aspect, only generate effective young leaders, physicians, we will generate effective healthcare systems. So Lorenzo, let's go to explore a little more deep that one. Understanding how important young physician leaders are, how we can improve in creating our future young leaders. What do you think, how can improve that?
Okay, thank you, Arnaldo, for your question. I can give you a very brief and crystal clear answer in few words. We must invest in education, yeah? So let me link to what my colleague said, and let me create a bridge from a system and global perspective to an individual perspective, a local perspective. We agreed that leadership is everyone's responsibility, yeah? We agreed that health systems are really complex, yeah? And so we must invest in capacity building. We cannot deal with something that is complex without investing in the education of people that have to deal with. And so we must invest in people that can create positive work environment, that can create positive social interaction, and so that they can deal with this complex system and move people to reach their goals of their communities. Let me provoke the audience, yeah? Maybe it's a no-sense question, but what if I travel from my home country, Italy, to Berlin on foot? Yeah, it's no sense, yeah? Why not by plane, why not by train? Yeah, it's a no sense question, but I have a more no sense question for you. Why aren't we teaching our health professional how to deal with this complex system? Why aren't we teaching to an entire generation how to create positive work environment and how to travel their career path and move their communities to their desired goals? Yeah. So it's a provocative question, but why are we allowing an entire generation to travel their career path on foot? Yeah, we must invest in education. We must include leadership in the curricula of health professionals.
So, Lorenzo, how we can do that one this changing in a situation in practice? How we can do that?
Okay, I make quite simple, but you need a lot of efforts. If you agree with this idea, if it sounds meaningful for you, if you feel as a health professional a collective responsibility for that, so you should find someone that agree with you, build your own network, or join other networks, and so together share your ideas, boost your ideas. You know, today we must thank World Health Summit, the InterAcademy Partnership, because they are giving us the chance to share our ideas. So let's do the same. Come back in your countries, in your home countries, and demand now to your national academies, to your scientific societies, to your universities, to your cultural associations that are in direct contact with the stakeholders and with the policymakers, and ask them, demand them, include now leadership in the curricula of a health professional. Yeah, that's it.
Thanks, Lorenzo. So, Hippolyte, we have a talk about how one can improve by considering educating our young people, the leader of the future. And we saw that it's possible for them and to have in training and acquire skills that will allow them to develop better in their leadership. What about the young people who are in the intermediate leadership position? Is there something they can do, the direct bots can do it?
Yeah, thank you, Hernando. I think on my perspective, it's very important to empower the young leaders who are in the intermediary position. And we can empower them in the healthcare sector through the following aspects. We have seen during the opening ceremony of the World Health Summit 2 days ago, there were 2 young leaders who were empowered, bearing in mind they were female also, Christina Shilimba from Malawi and Omnia from Egypt. I was so inspired to see them. They have given opportunity to speak at a very big summit of more than 3,000 delegates, and they were so vibrant, and you heard the inspiring speech. So the power of delegation to young leaders is very important to empower them to become future leaders. Sensitizing that, also Professor Rose Leke, who was a Virtuous Awardee in 2023, we have seen her saying that senior leaders have to step aside to leave young intermediary leaders to take over. We are the one who are supposed to push the healthcare industry forward. And how can we push if you senior leaders are stepping on the ceiling? You don't want to move aside. So we have to empower young intermediary leaders to get the positions to improve the healthcare sector in event and conference, in public speaking like what they did 2 days ago, in budget allocation, especially in the finance sector. We need to empower young leaders to propose and to allocate budget for different event organizations, including big events like the World Health Summit. Also, the other aspect of empowering young leaders is through coaching. And coaching can be done from our senior leaders, as well as from peer-to-peer coaching skills. I want to give my personal experience and personal example of empowering young leaders. I'm talking from my personal experience. When I was studying in the UK Masters of Global Health, I make sure that after finishing, I have to empower another young leader to come and study there from a low and middle income country. So I made sure that I did coaching to that young professional who was back home where I came from in Tanzania. I coached him, I mentored him, and he applied for the master's program, and he was recruited. Now he's studying his master's of public health and is expected to be a young physician leader. Currently, where I am in WHO, Geneva, I made sure that within the period I am there, I have to coach other leaders to become young professional leaders. I have mentored 2 young professional leaders coming from Morocco, another one from Uganda. I made sure that they have all the communication skills, all the leadership skills, so that they can be empowered. And currently they have been recruited in the WHO. So bearing from that experience, it drives me that even as we have the responsibility in every position where you are, you have to make sure you don't leave that position without empowering a young intermediate leader. Don't just stay there for 3-4 years and you leave that position without helping someone else to take over. So from those examples, I do believe that we as young physician leaders, young professional leaders, we can be able to make this world a better health and improve the effective healthcare system. Thank you very much.
Thank you, Polito, for sharing with us. That's a beautiful history about that. I don't know if Elena or Lorenzo have some experience to the coaching. Can you share a little bit about of that?
I think everyone needs coaching to get into a leadership position, right? Because we are not trained, as Ryan said in the beginning, we are trained as physicians. We are trained to solve complex medical problems. But when we step to the other side, when we are in a leadership position, that shift has to focus a bit. We still focus on our patients, of course. We still focus on their problems, but we need to take it further and see things from a different perspective. And we can study, of course, and we can read about it, but when we are there in the actual situation, it's different. And if we have someone to lean on, someone to tell us how to work through this problem or that, if we are put in that position as a practice example, sort of, then we will do it easier and easier. So that's important. I think coaching is very important.
Thanks.
Yeah, I totally agree with my colleagues. I would add that it's really important for every person, it not depends on the age, but we need a mentor, yeah? And I could not have a lot of experience, gain a lot of skills without a mentor. So we have to structure our curricula, our educational path really, really well, and we have to stop neglecting some topics and some skills like leadership and communication, especially in the health sector. Yeah.
Thanks. Finally, with our conclusion is that to create effective health system, we must educate and train our future leaders, so they will be more prepared for the challenges of the future in the healthcare system. So, half of all this panel, we open to the questions of the audience.
Since there's no question from the audience, I'm going to start the Q&A session. And probably I would like to ask Lorenzo. You are telling that we have to put some leadership training into formal education in order to not only train us in clinical skills, but also in the art of leadership. How would you propose for the policymakers or even for the medical schools to do that?
Yeah, you have a lot of stakeholders in the educational process. So you have to build like a curricula with a bottom-up process, and so you must be sure to include all the stakeholders. And I mean, we met together each other in this experience, and we saw how much were heterogeneous our educational path. Is it good? Is it not good? We cannot say, but we know that some topics must be included. And so I think that it's a process that you must start at the local level. Yeah, we speak each other at the global level, but at the local level we have to talk with the other stakeholders to find a solution in our context, because you know, to make laws, it requires a lot of time. And so starting from the local, we meet each other again at the global level when we did something that we decide together, yeah? And so it's not like heterogeneity that is caused by a lack of planning, okay? That's really important, because education gives you the skills to manage the future. We know that the high-skilled professionals are they play the pivotal role for manage the future, yeah? So for the health system, especially the effective one, yeah.
Thank you, panel. I was intrigued by some of your comments, but I think I have to pick up on the inflammatory comment that was made. And I think I need to speak for the more senior physician leaders. We said, some of the panelists said, that senior physician leaders need to step aside. Is that good for the future of healthcare, of policy making, if they step aside completely? Are we ready to lead? Are we able to do this effectively? Are we capable of taking this further?
Okay,
inflammatory comments.
Sorry, can I answer that? We don't need them to step aside, as we are not pushing them aside. What we say is that, like I said, we need to learn from them. They are very important. They are there for a reason, okay? And they have practice, and they know what they're doing, but they also need to empower us, and we need to learn from them, but we also need their help getting through to their position. That's the law of life, okay? We don't need them to step aside, but we need them as they are getting older and as they are preparing to leave, or even before that, they need to build us up and give us the tools to be able to replace them. And also, they need to understand that we are probably going to replace them with different views, with a newer approach to something, or something that is more meaningful to us, okay? Because we are a different generation. Even though, and we all felt this, is that even though our curriculum is different throughout our countries, we need that, we feel that there is lacking in this position and this kinds of teachings throughout our curriculums, okay? So we don't need to push them aside.
Jamil? Okay. Thank you so much for that opportunity.
Thank you.
Adesso introduco la seconda sessione. Everyone can lead, how to do it effectively, ossia ognuno di noi può guidare come farlo in maniera effettiva, come farlo in maniera efficace. Invito tutti i colleghi ad unirsi al panel, alla seconda sessione. Grazie.
So what we are trying to do here is to show some diversity from what we are coming from. So like my friend Christina has been saying, we thank to the previous panelists, and we'd like now to invite another 5 panelists to talk about everyone can lead, but how can we do it effectively? So please, my friends, come to the stage.
Good morning, everyone. Anyone can lead, but how can one lead effectively? I'm Butumelo Pagati, HOD of General Surgery, University of KwaZulu-Natal, South Africa. Before I dive deeper into the topic, I'll allow my colleagues to introduce themselves.
I'm Penelope Adinku. I'm a cardiothoracic surgeon from Ghana.
I am Ahmed Saman, a nephrologist and the student clinical placement lead, Mansour University, Egypt.
Hi, I'm Normina. I'm working in clinical nutrition and also maternal and child nutrition from Malaysia.
Hello, my name is Namondari Batar. I'm a head of Department of Pathophysiology in Mongolian National University of Medical Science.
Thank you, colleagues. The first question will go to Imad. When you think of an effective leader in the health system, who comes to mind?
Oh, it's a big story. So, I'll talk to you about if we are dealing with the concept of our session today, how to be effectively a good leader. So it always comes to our mind the role models, their history, their achievements were evident. But the real question is, how did they pave the way? Is it worthy? All the sacrifice, all the effort. I didn't find something better than our role model of this World Health Summit. You attended her inspirational talk in the opening ceremony. Professor Rose is a queen of everything. If you, yes, if you ask the Cameroonian ladies, they will tell you that's a queen of Cameroonian ladies. If you ask the immunologist, the queen of immunology. And maybe if today if we talk about her challenges, maybe it's a queen of leadership. So if you don't know Professor Leek, over the last 4 decades, there have been decades of work fight against infectious disease, remarkably polio and malaria, because she was aware of her community need. This is what I highlight. She believed in science, this is number 2, and she spent years doing research and helping people in suffering. So if we make it a roadmap or a step, start from the academia, the knowledge first, and then come to a realistic look to the community needs, then we should connect with the national authorities, then extend to the worldwide authorities. This is a roadmap for anyone who choose to lead and do an impact to community. If you remember her talk, she told us, no challenge, no life. Okay, so sure, her road was full of challenges, but lastly, never and never forget the family. When I hear these words from her, I start to give my laptop search about challenges she met and found some talks of her. She is here now, yes, in a glorious. It's in the, Verjao Prize, but this was not the situation 30 years ago. And this is some of her talks. In the very early days, when I went for months without any verbal communication with 2 male researchers, they tried very hard in public to put me down. So not only men, also women can be the worst enemies. But, and this but is very important, let this aside. Let this aside, and then go on. The second challenge, and I know that we all may face this challenge, is the family. It was not easy, but possible. I had to manage home where my husband is also a medical doctoral scientist. Partially, I couldn't shine more than him. It was a struggle, but I know my purpose and my goal. So if I conclude the lessons from here, it's a vision, that transferred to mission, that transferred to action, and it is not without a challenge. And we are talking about the challenges. I may leave the mic to my colleagues to what are our challenges as a young physician leaders. Thank you.
Thank you very much, Imad. Indeed, Prof. Rose Leke, what an exceptional, trailblazing, effective leader she is. Now, Nomina, coming back to us as young physician leaders, what are some of the challenges that we tend to face as young leaders?
Okay. Yeah, so thank you for posing that question to me. So now just like what Imad has said, even the great Prof. Leke herself has faced a lot of challenges throughout her journey. Yeah, and we as young leaders, we actually have a different breed of challenges, not at that position, but at I would say a lower level situation that we are at. Yeah, so the first one I would say experience. We are lacking a lot of experience in leadership, being put as a young leader. I know in the first session just now, we talked a lot about education, right? Needing formal education, for example, for leadership. Yeah, and some of us may have been trained for this, may have been ready for our roles, but some of us are really just being pushed into the position. I'm sure a lot of you probably, will be having this kind of experience where you just have to, I would say, step up to the role, yeah, for whatever reason, one reason or another. And there was no formal training, no induction, no mentorship, for example. Yeah, so that is one way of doing. Yeah, so we are having. I would say learning on the job while we do it, yeah. And I think when the outcome is good, yeah, while we are learning on the job, it's rewarding, yeah, because it is the result of our hard work. But at the same time, it has been a very difficult journey, I would say. Another challenge for us, I would say, is to manage our own peers. Someone that we have trained together with, probably spend 5-6 years together in your training in a medical school, and then suddenly, you have to step up to be a leader of this group, the same group that you have been learning together, probably have built a friendship with. Yeah, and there will be a shift or a change in the relationship dynamic. So how do you actually manage this? How do you navigate the shift and try to draw a line between your friendship and also your professional relationship currently? So I think that's one of the challenges that we have. And again, if you're talking about peers, we should also not forget our seniors, those who are more experienced with us than us. How do you navigate that? For example, in a university setting, you become a head of department, and the ones that you are leading are your former professors, your former supervisors, for example, someone that have taught you all this maybe 3-4 years, or someone who has, who you look up to. Yeah, so that is one challenge that you have to navigate. And of course, being a woman in a leadership position is something, is a challenge all by itself. Yeah, and of course, I cannot forget this. For young leaders, we are at the point of our career where we have to achieve more in our own field of expertise, right? On top of juggling the responsibility as a leader. So you are wearing different hats, while you're doing the job. So you're trying to manage a team and as well, and you want to achieve more, you want to progress in your career. So how do you balance that? Yeah, how do you want to make sure that you don't lose yourself, don't lose your way, and maintain your health and well-being while doing that? Yeah, and I think these are some of the challenges among many others, because there are a lot of others that we are facing.
Thank you very much. As challenging the challenges may be, that's what makes life even more interesting. Now, Penelope, please share with us, how can we overcome these challenges?
Thank you, Tumi. Some of the challenges talked about resonated well with me as I encountered them during my journey to becoming the first Ghanaian female cardiothoracic surgeon. And so I hope by sharing some insights, we as young leaders can find ways to overcome these challenges. I would like to start with mentorship. even as there's been a lot of talk and discussion about the older generation making way or handing over the baton to the younger generation, giving us center stage to lead. We implore them to take our hands and lead us on this journey, because their rich experiences can only make us stronger and better leaders. I'd like to take from something Dr. Alaki just said. I hope their ceiling will become our floor. And hopefully this floor will be steady enough and strong enough for us to stand on so that we can reach our summit. Secondly, the 2023 SDG report, the special edition, lets us know that globally women are twice as likely to report discrimination based on gender in our workplaces. And also, at the path at which we are going, it may take 140 years for us to achieve equality in leadership positions at our workplaces. So it is important for us as young leaders to develop our voices and to use these voices to generate discussions and create awareness about discrepancies or disparities, not just about gender, but about race and other disparities. It may take some time, it will not happen overnight, it may not happen in a day, but we do have to start from somewhere. When an issue is made very visible, it's very difficult for it to be ignored. Thirdly, I think it is important for us as young leaders to develop leadership capabilities. This can be done through workshops, through conferences, or one-on-one coaching. It can be in person, it can be virtual. And we will learn so many things from these workshops. I believe that one of the many things that we would learn is the various leadership styles and how to switch between these styles depending on which situation is calling for what. And mastering this, I believe we'll be able to deal with peers or seniors that we find ourselves leading in a team. Lastly, I cannot overemphasize the importance of a support system. It could be friends, it could be family, it could be a mentor or a boss. You know, just find that person or those group of people that you can talk to, you can confide in, pour your heart out to, and talk about your challenges to. And they'll just not only listen, but they will motivate you to keep going on, to keep pushing, because you can do it. You can achieve great leadership. I hope with these few insights, we as young leaders will be able to overcome the challenges that have been mentioned. That's by no means exhaustive, but to help us even as we take on the world. Thank you.
Thank you.
Thank you very much. Nomuna, anything from your side?
After when I participate in Young Physician Leader, what I have noticed is the young leaders face same challenges, like Normina said, peers, seniors, like Penelope said, gender and race. So that was so interesting for me.
Okay. Thank you very much, colleagues, for your insightful comments. From what we gathered from what our colleagues have shared, they've noted that an effective leader is an individual who inspires, who raises and nurtures more leaders instead of just creating more followers. He or she is someone who acknowledges the presence of a problem, but instead of focusing on the problem itself, they spend more time in finding the solution to that problem, as we have learned from the inspirational journey of Prof. Rose Leke. And it goes without a say that behind every successful, effective leader, there are mountains that ought to be overcome. And it is overcoming those mountains that makes life even more meaningful. I'll open the floor for any questions or comments to our panelists. Thank you.
Good morning, colleagues. My name is Natalie Myatt. I'm the Deputy Director at the National Institute of Communicable Disease. Congratulations to the panel and to all the young aspiring leaders in the audience. I'm also a mentor on the Kofi Annan Leadership Program. And one of the things that I want you to consider, leadership is about influence.
Yes. Yeah.
And don't aspire to leadership, becoming a leader, aspire to influencing the world. Yeah. The leadership title will follow if you influence. And begin that influence with self. You've got to influence yourself first before you can influence others. And my journey began by reading. There are thousands and thousands of books of the journeys of leaders who have walked the path before us. Start by reading. Start by formalizing the mentor-mentee relationship. It's got to be formalized. And you will find leaders that you learn from, and they'll tell you what not to do.
Yeah.
So leverage on that as well. There are leaders who will teach you those lessons. But it's about influence. And it's not influence the social media influence, the number of influences that you have. It's actually about influencing in your immediate circle of family, friends, influencing in your community, whether it's picking up a piece of paper on the sidewalk, that's influence. You showed somebody that you, as a physician, are not high enough to be able to pick up that piece of garbage on the sidewalk. If it means sweeping your street, that is influence. So never aspire to the title, but aspire to the influence. Thank you.
Yes. Yes.
Hello, hi. Thank you for the very insightful panel of discussion. My name is Shafira. I'm originally from Malaysia. I've been in the UK for my education and training for more than 10 years. I'm a clinical doctor and currently specializing in obstetrics and gynecology at NHS England. So my question is with regards to managing conflict within teams and organizations. So how do you overcome the challenges and the negative effects of conflicts within teams and organizations, especially, when you submit a brilliant idea, but the teams and organizations are resistant to change? Thank you.
Yeah. I can take the answer. As you say, the conflicts is an everyday life. So in every day we have conflicts. That's why I confer to the previous session of the importance of education. The decision-making process is worthing to be educated to all of us. So if we can work with each other as a team, we will can overcome these conflicts. Because the mechanics of decision-making, how I can share my opinion inside a group, how can I be loyal for this group after taking the decision. This may be the solution for this. But if you are speaking about something that you can make it really now, is number one and number two and three, put yourself on the side of the other always, not inside of you. So all of us have concerns, have solutions, have opinions. So why we are thinking about ourselves? If you see one of the pillars of the leadership is the emotional intelligence about the others, how I know myself, like the professor told us, how to sense the others, how to know the other concerns. If all of us know the concern, so sure we can make a compromise. If I know your concern and me your concern, so you will have some compromise and me some compromise,
it will help. Till, again and again, the education of the process of decision-making is very important. Thank you.
Thank you very much, Imad. Also, just to add, it goes back to the issue of personal development. Even if it means you have to go for a training on conflict management, I would advise that you do so. It has helped me so much because after attending that, doing that module, I had to learn to distance myself a bit from the conflict, analyze the conflict so as to get to the root cause of that conflict. And once you've identified the root cause of the conflict, then you are able to bring a solution that won't just lead to us compromising, but the solution that may work for everyone in the team. So you can consider a module like that, because conflict management is quite broad.
And just to add, I would say that some amount of conflict is good. It encourages diversity and brings out so many opinions and views, and that at the end of it, you can even come to a better decision. And so some amount of conflict is good, but you need a dynamic leader to work through the group so that at the end of it all, you have a cohesiveness that you can implement decisions with.
Okay. Thank you. Any other questions?
Hi, my name is Rida Maftun. I'm a young physician. I'm young, but I'm a physician from Pakistan.
Leader to be.
Hopefully. And master's in global public health here in Germany. I agree with you all and applaud you for saying the right things and all that we're thinking on a global platform. And I want to ask you, is there a platform where we can connect with you or people like you for mentorship, like as you've mentioned? And this is for all and the previous panel as well. Thank you.
Okay. I think, Joe, they are creating alumni for us. They are working for more than 10 years now, so they have around 200 of young physician leaders, and they are all gathered in the alumni, so follow us on the Twitter.
In the absence of any other questions or comments, this brings us to the end of our session. Thank you for your attention, and thank you to my colleagues. Thank you.
Thank you.
Right. Thank you so much for the interesting question. Actually, building on from Dr. Shafira's question just now, do you think we can come together leaders from all over the world without conflicts? No. For the past 2 days, we have a lot of conflicts. Even in making decisions, we talk a lot, talk, but in the end, we come up together. We have some trained by Joe and also by Nora to give us style of leadership, various styles of leadership, how to be ambidextrous, how to change in the styles, and in the end, we come up with an outcome that is better than an individual outcomes. Right, so selepas ini, kita akan bercakap tentang leadership ataupun kepimpinan adalah sesuatu yang universal. Tetapi, adakah ia sebenarnya universal?
What Amural is saying in Malay is that leadership is universal, or is it? Well, our next panel is going to lead us through some of the regional, the international challenges that we all face as young leaders, as aspiring leaders, as ones who want to coach, who want to mentor, but also want to be coached and mentored. So I invite our next panelists to lead us on this topic. Thank you.
Follow. So what we wanted to focus on now is we've talked a lot about why you need effective leaderships for effective health systems, what the core principles and pillars of good leadership are. But one of the brilliant things that Camille actually came up in with one of our discussions was how do you translate leadership to different contexts across the world, and what do we need to be mindful of when we're kind of moving core principles across those different contexts. So my name's Jamila Hussain. I'm a palliative and end-of-life care physician from the UK with an interest in inequalities at the end of life. So Camille, I'm going to come to you first. So you're a diabetologist, a public health physician, an epidemiologist from Cameroon. What has your personal experience been about leadership in different contexts?
Thank you, Jamila. Thank you for being keen on calling all these titles that actually don't mean anything. But yes, I was born, raised, and studied for most part of my education in Cameroon, which is a really nice country in Central Africa, sometimes called Africa in miniature, because it seems to have a little bit most of the diversity that you would find in other African countries. So really my view on leadership is really grounded in what I experienced and what I witnessed growing up. So growing up in Cameroon, and I think this is true for many African countries, not trying to claim that Africa is it's too homogeneous, but I think we share some similarities. And if you look at our leadership, you would see that we share a lot of similarities in that. So growing up in Cameroon, leadership was very much of a directive style where you were told what to do. You were not expected to think. You just had to, you just had to do what you were told. And that's really that's the leadership style that we understood. Some people could find it problematic, but that's what we understood because from childhood in school, you were taught to do exactly what was requested of you. If somebody needed you to move the ball, you would be told clearly, move the ball. But we understand it's not the same thing in other cultures and in other countries. When I moved to the UK for my PhD, I struggled a lot for the first few years. I have no problem with the Brits. I love you very much. But I think culture really has an influence in how you deliver leadership. So when I moved to the UK for my PhD, my supervisor, who I like very much, and we finally got along very well, and I was able to complete my PhD in the 3 to 4 years I was required to do. But I struggled at the beginning because his leadership style was very British. I mean, he didn't adapt to me, and at the beginning, I think I didn't adapt to him. You know, the British man would tell you, if I were you, this is what I would consider doing. But that's not what I was used to, and I wouldn't understand something like that. I was used to do this is what you should do, this is what is right, this is what isn't right. So I think that got me to understand that leadership is very much contextual and should be adapted to people based on what they come from and based on what they understand, because if somebody doesn't understand what you're saying, you could be a very good leader, but that's not appropriate to me. And if you look at this panel, I mean, you have Sri Lanka, you have Indonesia, Brazil, UK. How do you attempt to lead a group as diverse as us without understanding our lived experiences? So I think culture really needs to be taken into account when you want to deliver leadership effectively. And even gender, I mean, in my culture, gender is a big thing, right? The way you would lead a female group, it's very different from the way you would lead a male group, because there are assumptions about, I mean, if you use a very participatory style where you want the female to be, the woman to be very happy, I mean, that could be misunderstood as other things. So all those things need to be taken into account in order, in my opinion, to deliver an effective leadership. Thank you, Jamila.
Thank you. That's so fascinating, isn't it? Because I think just through that lack of cultural humility, you could really kind of sideline a leader who's kind of emerging at that PhD stage. And we really want to do like global and interdisciplinary research, but understanding that's key. So Marita, so you're an internal medicine resident and you work in both Poland and Indonesia as an academic as well. I guess, what are your thoughts about, what do we need to be mindful of in terms of the challenges in the Indonesian context and leadership in particular in healthcare?
Well, yeah, the challenge to implement the leadership in Indonesia, it really affected by the diversity of our ethnicity and also geographical distribution. You know, Indonesia has 17,000 islands, so it's one of the most populous islands in the world. And also, to add what Camille said, it's also really affected by our cultures. Just to, as a description, Javanese culture is the most biggest ethnic in Indonesia. It forms the largest ethnic groups. And in Javanese culture, it's very much associated with communal values such as willingness, the capacity to self-control, patience, and calmness. And it also has very strong emphasis on maintaining peace and harmony within the community. And that's why people tend to sacrifice their personal interests for the harmony in the community and to avoid all types of confrontations, I mean. So in one way, it has disadvantage. It has advantage because it helps us to maintain harmony in the community and promote us to respect the elders. Because in the Javanese culture, we also has very high degree of hierarchy and respect to seniority. So in one side, it promotes us to respect the elders, but in other side, it has some advantages, especially in the terms of leadership, because it prevents us to have a effective task division, and so it obstructs the progress to reach the effective healthcare system, and also effective leadership. So to implement the effective leadership, we need to really take into account these cultural characteristics.
Yeah. And I think that's a bit of a contrast to the British one, because we spend a lot of time. I think I've noticed that just with our conversations, I would come away and go, that was a good conversation, and other people will say there was a lot of conflict. I was like, where was the conflict? I thought it was just a discussion, but to see the other side, that the harmony is really beneficial, but also any extremity has its limitations. Thank you. So coming to Tiago, so you're a psychiatrist, academic and educator in Brazil. What are your thoughts about translating our leadership principles to different contexts?
So thank you, Jamila. Thank you, everyone, for being here. I think it's been 2 intensive days of training that we had in the IPL program. And it was really a fascinating new world that opened for me, having a lot of text to read about leadership, having Joe, Nora giving us excellent lectures on training and exercises, to discover a whole new world on leadership training, and to discover that it can be taught for people. And when I was telling about this experience for my colleagues in Brazil, I called them, and I caught myself a lot of times saying, oh, and I've learned this, and that, and it was very great. But I think that for Brazilian context, we would have to adapt this and that. We've made this exercise and we had this reflection about what happened. But I think for the Brazilian context, we would have. So with all these buts that came to my mind, I realized that we have different styles. And most of the leadership literature come from Anglo-Saxon countries. So we have a lot of material produced in the US, in the UK, Australia, Western Europe. And this is a really rich, great, and powerful literature, but maybe it does not fit all the countries in the world. Should this mean that we take this literature and should put this aside? Definitely not, but we must adapt to our realities. In Brazil, we tend to get things very personal. We tend to have close relationships with our colleagues from work. So the colleagues from work are expected to be friends and to go out together and to like each other. And how do you manage a conflict in this situation? How do you take this literature that says, oh, you just have to give a clear feedback to your colleague. You just have to say the negative aspects of his or her attitude. But if I do that, probably he will not be my friend, she will not be my friend anymore. And this is really important to keep the professional environment. So how do we manage this personal professional relationship that, especially in Brazil, but also in Latin America, is so important? So thinking about a leadership profile in our specific cultural context is fundamental.
Thank you. That importance of not... It's really hard to resist the colonization, isn't it? Because it's so, like you say, it's interesting, you get engaged in it, but I guess the leadership is making sure you do take a step back and listen to your heart and go, actually, this doesn't quite fit. That's really, really important point. So Maranti, so you've been a real trailblazer. I've been in a few sessions with Maranti, and you think she's very quiet, but actually she's done so much. She's a pediatrician, a hepatologist, set up the first liver transplant unit in Sri Lanka, and really is someone who gets things done. So what is it that you want to share with us about the Sri Lankan context and healthcare system in Sri Lanka that we need to be aware of when we're thinking about leadership?
Yeah, thank you, Chamili. Good morning to everybody. As she said, my name is Maranti Fernando. I'm a pediatrician and pediatric hepatologist and a liver transplant medical specialist. Firstly, I would like to thank the InterAcademy Partnership and the Young Physician Leaders Program for bringing us together and giving this inspiring leadership program. I think, to answer to your question, I think it would be always interesting to give a genuine story, give a real-life story, provided it will fit the context. So when I was back in my training, before I talk about challenges, as a trainee, I saw a lot of children in Sri Lanka dying of liver diseases. Just to give the context, the first pediatric liver transplant happened in the world in 1963, and today we are in 2023. So it was the norm in Sri Lanka for children with liver diseases, biliary atresia, liver failure, to be considered as a deadly disease, which is not the case in the developed world, where the standard of care is liver transplantation. So I was quite determined I should go abroad and get a training in pediatric liver transplantation, because at that point, liver transplantation for adults did exist. And they were quite thinking, for pediatrics, it's quite complex, maybe we can't do it. So most of the kids died. So I was quite fortunate to get that training in a liver unit in Birmingham Children's Hospital in UK and come back to Sri Lanka to start with my work. So coming back to our leadership challenges in the Sri Lankan context, we all talked about the challenges, conflicts, negative things on our way. I actually saw challenges, but behind that, I saw opportunities. I saw the need was there to commence a pediatric liver transplant program. There were people who were enthusiastic to do that, so I saw so many opportunities behind the challenges. However, it was not quite straightforward. When I returned to back home, it was the COVID-19 pandemic in 2020. Following that, as a country, we faced unique challenges. If you have heard in the newspapers, in the news, that we are amidst an economic crisis as a country. So the political colleagues, policymakers, they did ask us, is it the right thing to establish a pediatric liver transplant program, which is quite costly and demanding amidst of this crisis situation? The answer was yes, perhaps yes. The reason behind that is, yes, we do have limitation of resources. Okay, let's use the health budget effectively. However, can't we ask for partnerships? We were talking about partnerships during this conference. We were talking about public-private partnerships. We were talking about charity. So what I wanted to emphasize for the young people here, we did saw the opportunities behind the challenges. We were able to commence the pediatric liver transplant program, and our 16th liver transplant kid is currently in ICU during these last 3 years. So amidst the crisis situations, amidst difficult situations, challenges, we saw opportunities. And just to give the context, we were talking about gender equity and women having challenges. Let me ask this simple question. How many of us are female in this panel? How many of us are women in this room? So it is challenging, yes, but we have made it. So I always encourage the young people to see the opportunities, positive aspect. If you are determined, you can do. Lastly, I was so inspired by what I heard from the audience, from the senior mentor leader at the back. You don't really concentrate on the title. You be determined and make an influence. The title will come behind you. That's what I was thinking. Thank you.
So I think one of the things that I've really liked about this summit is that we don't want to just focus on the problems, we want to focus on some of that solutions. So I guess coming to you, Camille, what do you think the things that we need to keep front and center when thinking about the solutions in adapting leadership to different contexts? What do we need to be thinking about?
Yes, so I think you've used the right word, right? Adaptation. Adaptation is key for everything. So when I was talking about my story in the UK, what I didn't mention was I successfully navigated my PhD, but then I had many colleagues who were not so fortunate as I was because they didn't understand the leadership style, so they had to fall out of their PhD simply because they didn't understand the mentorship. So at the end of the first year, the Viva didn't go on well because the things were not aligning with what the supervisor had wanted. And so it was very sad for these colleagues, but I really felt bad for them because I saw a lack of adaptation here, a lack of adaptation from both parties, from both the supervisors and from the students. So it's about finding a middle ground. With my supervisor, first of all, in Cameroon, there is this very hierarchical way of functioning. So a professor is a professor. You need to address him by prof. Wherever you meet him, there is no first name. And so when I got to the UK, I had to call my supervisor prof. And he was like, please, can you call me by my first name? I'm not comfortable with that. And every time I would always be prof. Nice day, prof. Okay, prof. So at some point, he had to adapt to the fact that for this leadership to work, maybe he needs to understand that I need to call him prof to be comfortable at some point. And I also had to adapt to his leadership style. So when he started saying, Camille, would you consider, Camille, if I were you, I'd be inclined to. I think I started stepping up and, okay, prof, so are you saying this is what I... So it had to become a bit more clear. We had to find a middle ground, come together, and both of us adapt to make this leadership working. So I think adaptation, it's key in everything. You can't be rigid and expect people to walk up to your standards just because you want things to work. So both parties or both groups, the group and the leader, need to come together and make things work.
Yeah. So it sounds like it's not just adaptation, that actually allows growth, doesn't it? Because you're both learning. Marita, is there anything you want to add?
Well, I just want to add about the from the cultural perspective, because as we already discussed, that every culture has the advantages and disadvantages, and also to add what Maranti said, cultures becomes challenge, but there is also the opportunity to use the culture to leverage our effort for efficient healthcare system and leadership. For example, the culture characteristic of maintaining harmony and keep the communal values as a priorities in Indonesia, we could use it to leverage the effective healthcare system, such as encouraging the people to submit themselves to the universal healthcare in Indonesia, because not all people now are already in the universal healthcare, but by encouraging themselves to keep the communal values on top of everything, then we can encourage them to submit in that healthcare coverage. And also we need to try to bridge the culture which is obstruct us from progress. For example, like this culture of hierarchy and seniority, there is one of the example of best practice from our Minister of Health that now he really tried to combat bullying and the practice of unhealthy seniority in our residency and specialty training. He put very strict punishment for the hospital or university, because our system is still university-based, to the university if there is any report of bullying from that university. So it really helps us to move forward to prevent bullying in our education system. And also adding about mentoring that was already mentioned from several panels before, it's also very important, the mentoring to encourage, to teach the younger generation, us and younger than us, to have the assertiveness and negotiation skill, because that's very important in our culture specifically.
Great. So we've got a couple more minutes. So Tiago, I'm particularly interested because one of my areas of interest is racism and colonialism. Do you think we can actually decolonize education in terms of leadership?
I think that we still have this feeling that a leader should be born and not educated or created. But I think that throughout these days, we learned a lot that a leader can be taught, and our natural abilities can and should be improved. And I think that, as many colleagues have reinforced it, and I think that this should be one of the main take-home messages that we thought about this session, is that education might be the key for that. So we must encourage our students, we must be open to learn from our professors, for the older leaders than us, that there are abilities that we can develop, and these abilities must be considering the context of our own countries, our own institutions, because we must remember every institution has a particular culture. So getting to know that is something pretty important. And I think that producing our own research on this field. So let's take the best from the American experience, the UK experience, and how can we translate that to the Brazilian context, to the Indonesian context, to the Cameroonian context. So let's make research in our culture. How can we adapt what is similar and we can put into practice, what can be made differently for our reality? And it's important, but I didn't know that leadership is not my field of research, so I'm not aware on about how to make it. But in my university, there is a business school. So why don't knock on their door and ask, oh, do you have someone making research and leadership? Can you help us? Can we work together? How can we bring this from the business environment to the healthcare environment? So I think that the resources are much more on our reach. We just have to go and look for them and find them, and have this spontaneous way to connect with people, being more open. At least that's something that the Latin America culture is open to. So can I just send you an email? Can I just make you a call and send a WhatsApp message? I found your contact online. That's something that might sound really weird for an American, but it's really common in Brazil. So everybody has WhatsApp. So can I just text you, and can we connect sometime, have a coffee? So I think bringing this and valuing our own culture is the most practical way to decolonize education.
And Miranti, is there anything you want to add quickly? Because I want to make time for at least one question.
Yeah, I'll be very quick. So I just wanted to highlight few points in the end. As we talk in this session, the leadership is universal. And we all are leaders. We all can do effectively. I think we can do more effectively if we get a formal training. I had been in a leadership position for last 3 years, without knowing what it is actually. I didn't have a choice, but I got to know certain things I've done right, certain things I could improve. So whenever possible, we should reach out for a formal training, mentorship, and for senior colleagues for some advice, mentorship. That's very important. And the last thing, because of the time, I would like to highlight, we all need to understand we all are leaders at different contexts and different situations. So let's make it our own responsibility rather than looking at the other leaders and kind of a complaint. We say, all of us are leaders, let's do it effectively.
Thank you everyone. So hopefully I'm asking for permission for some questions. Anyone got some questions?
Speaking of different contexts and different cultural backgrounds, do you have an advice for different colleagues, like how we can understand and how we can see or sense this context of different backgrounds, as we consider ourselves like to be in the different positions with the different people that are coming all around the world? Thank you.
I think cultural humility is a really important. I guess I'm coming from a UK context where, you know, we really need to own the colonialism and the impact that has had across the world. So I'm always mindful of that, and having that humility that our way, which is often presented as the dominant way, isn't always the right way, the most effective way. And I think definitely in terms of from the UK perspective, we need to have that humility and to listen, because actually not only to give the space for other people to do it in their own way, but also there's so much for us to learn from different contexts in terms of, what Murat was saying about, the Indonesian, primacy of harmony might actually feed into supporting the concept of justice for health and people actually prioritizing community. Like, that's such a big strength that we can learn from. So I think cultural humility is really, really important. Anyone else?
Yes. So if I can add something to that, I think communication is key. It's very unfortunate not everybody communicates, but I think if you're able to speak out clearly how you feel, then that would make things very easy for most people. So again, when I was doing my PhD, I had to tell my supervisor, I'm not very comfortable calling you by your first name. I need to call you Prof for this to work. When I would send an email, I can use the first name, but face-to-face, I'm not comfortable. So I told him, at the beginning but at some point he had to let me, because that's what worked for us. And also, I think he realized with time that some information wasn't going across clearly. When he would say, Camille, could you consider doing this? Would you consider accepting maybe that journal and not that? And he says, I don't do it. I think he realized there was a problem with communication, and with time he came out more clearly. So just observing, so if you want an outcome to happen, and you realize that outcome is not happening, then maybe you're not using the right style, and it's about time to adjust. So being humble enough to observe and also to communicate clearly what you want, I think can limit some of these challenges.
And many times when I caught myself reading those texts about leadership, I had this feeling of discomfort. I mean, this doesn't quite sound right. I must be misthinking. It must be my problem. And in another moment, oh my God, how do I change a whole country culture? I should go back to Brazil and tell people about that. And when I caught myself thinking these two things, I stepped aside, as my colleagues mentioned, and thought, okay, maybe this is not my personal discomfort, maybe this is a more cultural discomfort. I don't have to go back and change my country's culture, that's not possible. Maybe we must adapt. So I think that we must value these gut feelings that we might have when reading about it, when going to conferences and hearing people talking about that. When you feel this weird feeling, the butterflies in the stomach, that might be the point that you are going to have to give a deeper thought and try to think of a different strategy for your own context.
And if I may add, this also needs our openness, because we already come with our own bias. We have bias that is formed by our culture and all other backgrounds, and it affects us in how we frame any problem. It's different. We have different framing. Everyone see it differently. So by at least realizing it, when we talk about a problem, it will help us to try to put our feet in other people's shoes. So we may not see the problem in the same way, but at least realizing that we have different way in seeing a problem, it will give us any tolerance and any tolerance in seeing any problem.
Yeah, just one thing at the last. I think as leaders, young leaders, despite being in different cultures, it's very important that we unveil other abilities, strengths as leaders. For example, I'm a pediatrician. If I'm just going to strict, okay, I'm a pediatrician, I do my medical stuff, I think we would not be very successful in this public-private partnership, getting everybody else to help. Just to give the context, when we really want to build a new liver transplant hospital to the country, we had to partnership with the corporate sector. So if I'm like, getting very much strict to my specialty. I'm a doctor, I'm not very open to corporate sector, getting communicated with them, I might not be successful. I think it's a cultural problem as well sometimes, because at back home in Asian culture, the doctors, they have a different mindset. They think, okay, we are doctors, but I think this is now more than ever we need the partnership with the corporate sector, because we need money to help people. We need money for health. So let's become open for everybody. Let's have a good partnership with the corporate sector. It's not the medical professionals. We all are important. We all are equal. Yeah.
Right, okay. Thank you, everyone, and we better leave. We've overstayed our welcome already.
Thank you. So, any question? Any other question? Please.
Hi, so I'm Gustavo Serrano, a physician from Costa Rica. For anyone who's been on the panel, how could you maybe navigate situations where you encounter leaders or people in positions of power who are reluctant to share their knowledge with you, and you can see a value in the knowledge that they have, or maybe when they agree to share it, they do so in a very like hierarchical way, as in just, I speak and you listen. How can we, any thoughts on how to navigate these situations?
So, which one of you would like to answer?
Right, Jamila. It's okay, you can have your go first. Perhaps you want to come here and answer?
Yeah. Okay. I guess, I think one of the, I've been going around speaking to lots of, particularly women of colour in leadership here, and one of the feedbacks I've got is actually find your people. So there will be other people who are much more amenable to mentoring and bringing up the next generation. There's loads of them here, and actually going against a brick wall probably is just a waste of your energy. So find those relationships and then invest in those key relationships is kind of one of the things I'm taking away from it.
Right. Is there any other question that would like to be asked? Yes, please.
Good morning to you all. My name is Namtebi Joanita from Uganda. My question is, how do you handle leadership across a cross-generational team, like various generations? How do you handle? Thanks.
Anyone from you guys want to answer? Or shall I just answer it? Right. So, in the 2 days program of YPL, we were taught about different styles of leadership. There is a coercive style which wouldn't work with our professor. You wouldn't be able to say, Prof, you need to do this. Definitely not. But there is another style, which is the democratic style, where we involve our professors in decision making. Being able to change into these different styles will work well. And I would like to reiterate what Camille has said just now. Communication is the key. No one in the world wants to do bad things. No one in the world wants to be a bad person. They just have different priorities and they just have different values. If you communicate your values well, even with older generation, he or she will hear you and you will be do just fine. That's my belief.
Just to add to that, and just to complement both questions, I feel like we are talking about leadership. We're talking about our influence in these environments, but we're also talking about our humanity and how we expand and evolve and take things forward. And for any human process, there needs to be a relationship. There needs to be relational leadership. There needs to be relational movement. And we cannot do that if there is no communication. So we've spoken about these communication systems already, and how to employ different techniques, as Amiral just mentioned. But if that relationship is not existent, we cannot expect to have a movement forward. So if there is resistance, as was said, we need to invest where there is relationship. We need to invest in where we can move collectively. I think at this point, I'm also just going to add some of the points that I was sitting there taking some notes, and I just want to expand on what my colleagues have said, because I think that there's quite a lot of wisdom amongst this YPL. I thank you, panelists, for the discussion. So I jotted some of them down. So it says, one of our first speakers spoke about leadership, and she said that leadership is the ability to guide and inspire and to influence others towards achieving a common goal or objective. It involves taking charge and making decisions and providing direction to a group or individuals. A leader is someone who possesses strong communication skills, as we've just mentioned again, and some strategic thinking and abilities. But like I think it was said a few seconds ago, actually, that leaders are not born. And we should stop thinking that they are just born. We can create these leaders. We can empower these leaders. We can educate ourselves, and we can educate each other to become those leaders. Elena mentioned also that effective healthcare systems is a meeting of goals of quality healthcare, minimizing waste, wasted time, and wasted expenditure. But I want to implore again that leaders are cultural changes. They are changes in this relational manner, and that surpasses healthcare. We need to move forward as humanity, and humanity needs more. Reflecting on Penny's point, I think it was Penny who said that it would take 140 years before women and men are treated equally. I'm a father of a 4-year-old African girl. She's amazing. She's cute, she's intelligent, and I am not willing to wait 140 years before she has equal voice at the table. So, but similarly, it's also not enough for young professionals and young physician leaders to be invited to the table. We need to have equal voice at this table. We need to be deliberating in these discussions about education, about curriculum, about budget, and about the priorities that our leaders are setting for us and for the next generation. So we as young leaders need to involve ourselves. We need to form these relationships. We need to forge these relationships, and we need to demand our place at the table. I also want to reflect on the fact that we spoke about Prof. Rose Lekke and the challenges that she faced. And I say this to us young professionals, that we cannot wait until we are the great Professor Lekke before we take on the coaching and mentorship role. We cannot wait until we have been the laureate. We need to invest now. And so I thank you for your time. And so I'll pass to Amirul for closing remarks.
Right. Before we close, may I just ask my colleagues just to stand up for the benefit of those of you who wants to engage with us off the stage later on. So these are the young physician leaders of 2023. We would like to extend our thanks to InterAcademy Partnership, ESMT Berlin, especially to Joe Bufford, especially to the ESMT like Sofianiti, Rick Hoffman, who's not here, and Nora Gressely, who have been giving us a lot of trainings that we believe that we are able to bring home and probably nurture young leaders. So we thank you for that. And lastly, I would like to close with some quotes. Let leaderships be like the bamboo tree. It is strong, unwavered. It can be used to build a shelter that lasts for hundreds of years. But at the same time, it is also pliable and flexible that can be suited to any structure that you want to build. At the same time, more importantly, as the bamboo grows, the smaller shoots also comes from the ground. Leaders nurturing new leaders. So with that, let's become effective leaders. Thank you.